Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Gollin.
Hey everyone, welcome back to the Gastro Girl podcast, where we empower patients with trusted insights to navigate digestive health. Today we're focusing on something at the heart of IBD care: how patients, advanced practice providers, and physicians can work together as true partners in shared decision-making. I'm thrilled to be joined by two experts from the IBD Center at AdventHealth in Orlando. Dr. Jennifer Seminerio, she's director of the Inflammatory Bowel Disease Center and associate professor of medicine at AdventHealth and University of Central Florida, and Megan Pearce, who's a nurse practitioner, and she works closely with Dr. Seminerio in the IBD Clinic. Together, they'll share how a strong APP and MD relationship enhances patient care and what that means for you as someone living with IBD or caring for someone who has IBD. Dr. Seminerio and Megan, thank you so much for joining me today. I'm so excited to talk to you both about the role of shared decision-making in IBD patient care, and especially the relationship that you have as a physician and gastroenterologist, and you, Megan, as a advanced practice nurse practitioner, how you work together for the benefit of the patient. This is so exciting. I don't think we've ever had a gastroenterologist and a nurse practitioner on together in the same episode. This is great. So welcome.
Thank you.
IBD, inflammatory bowel disease. Just give a little primer. What makes this such a challenging condition to manage?
I mean, I can start. I think inflammatory bowel disease is a condition for which we don't have a cure. So I think that's part of it. The patients are typically diagnosed young. However, there is any level of age in which it can be diagnosed, so it doesn't have to occur there. It can impact not just the GI tract, but anywhere in the body. And probably the biggest thing that makes it so life-altering is the fact that we talk about it as a ghost illness. So imagine you feel terrible inside, but look perfectly fine on the outside, and constantly trying to manage that and, fulfill your expectations of daily living and live a normal lifestyle. And then there's just so much that goes into having chronic diseases, from a standpoint of the work you have to put in with insurance companies, the effort you have to put in with specialty pharmacy, following up with all of your appointments. And when you're doing something that has such an impact in the gastrointestinal tract, that requires interventional procedures like endoscopy and colonoscopy, ultrasounds, MRIs and CT scans, sometimes surgery for these patients. So it really, when you are diagnosed with this, whatever degree you lie on the spectrum, it can be very life-altering from a qualitative standpoint.
So Megan, what is your, from your standpoint as a nurse practitioner who probably really is in the weeds with the patients, what do you feel makes this a challenging condition?
Yeah, I mean, as Dr. Seminerio mentioned, I think a lot of it is the progressive nature of the disease and the effect on patients' quality of life. So our younger patients are worried about missing school or, activities that are important when you're younger. We see a lot of college students. So obviously there's missed classes, missed finals when they're not feeling well, needing testing accommodations, those kinds of things. And as patients get older, other things are important, like social events and being able to go out and not have to worry about where the bathroom is. So a lot of it is more about quality of life, missed days of work, missed days of school. How are they going to kind of accommodate their symptoms? And like Dr. Seminerio said, a lot of people don't know that the person is feeling bad and they kind of hide it, and just how that affects their daily life.
Inflammatory bowel disease can take two forms, right? At least two. There's other forms, but the main two are Crohn's and ulcerative colitis. And, if we take from once they're diagnosed, we start the shared decision-making, right? It's like what treatments, and that can be very complex. So if we could talk about and define what the role of shared decision-making is in the context of the treatment and the treatment plan, I think that would be really helpful for our listeners. So Dr. Seminerio, what does that really mean in the context of IBD?
Yeah, I mean, shared decision making on a grand scale is the idea that, when you're discussing what you're going to do and the way in which you're going to do it, you're involving the patient and anybody that the patient wants to be involved in that discussion versus dictating to them what you're going to do. And so in inflammatory bowel disease, that's a lot of different things. I think the easiest is when you talk about medication and management, right? And making sure that they have options and choices, and that if their idea of what they want to do differs from what you want to do, that isn't necessarily abandoned because you don't believe it's the correct pathway to go down. So we're really big on contingency plans and having options that if we go down this path and it doesn't work, that there's somewhere else we can go to. Beyond medications, it's discussing with patients how to proceed in the timing of which we do procedures or ultrasounds or laboratory testing, trying to fit it in with their schedule, their work. I think one of the things that has transformed inflammatory bowel disease care since the pandemic is virtual medicine. And so having the ability to have some of their appointments be not in the office is really good. And then as it pertains to our practice, we are really big on a team approach. And we're an IBD center and we're very lucky to be an IBD center. But one thing that patients have here is they know that every member of this team specializes in inflammatory bowel disease and that their care is not going to be different. So part of the shared decision making is being able to go to any member of my healthcare provider team and ask a question and know that you're going to be given the autonomy to direct that question, and that question means something as it pertains to your care.
No, thank you. Now, Megan, from your perspective as a nurse practitioner, how do you see patients benefit when they feel part of the care team?
Yeah. So when IBD decision making is happening, when the patients are a part of that decision making, it reduces their anxiety when they feel like they're being listened to and their questions are answered. They have less anxiety about it. When they're part of the decision of how it's going to affect their care, they're also more likely to be compliant. If we just direct what they're going to do and they're not going to do it, their disease will likely worsen. And having that discussion with them and also asking the questions, right? Because they don't know always what to ask or what to tell their providers. So asking about, what other supplements they're taking, because, people read a lot on the internet and there's lots of suggestions, but being open to talking about that and discussing it with them is really important. But again, it's very fluent. We always have to kind of change course. And like Dr. Seminerio said, having a contingency plan and being able to say like, okay, well, if this doesn't work, what's our backup plan? I just think it helps them feel better about their care when they're more engaged, and they typically have improved outcomes when they're part of that decision.
I would also add too, it makes them more honest, right? We gather more information. It's beneficial to us. We learn about the alternative therapies that they may be considering or doing. We learn about the other providers that they may be seeing or asking advice from. We learn about what they're doing outside of the medical environment, whether or not it's blogs or things that they read on the internet. We become a part of the conversation when we make their opinion matter.
Oh, this is so great. And this is my favorite question because it's kind of like a symbolic, the way you guys are sitting here today. The APP, or the nurse practitioner and gastroenterologist relationship in action. I love this part because, you work side by side in the clinic. But I really want to help patients understand what that relationship looks like and how does the physician APP or nurse practitioner partnership translate into better care for patients.
So we're very fortunate to have such a great team and partnership, really. And we share a patient panel. So we all, even though we all see specific patients in clinic, we all sort of know what's going on with the patient. And I think that leads to better care because there's not gaps in information that's happening. And we're always aware, like after a colonoscopy, a procedure, okay, I'm going to see the patient in clinic. Here's what we need to do or adjust. And having that trust in that we're all making the same decision for the patient. They don't feel like, oh, okay, well, if I talk to this person, then I'm going to get a different answer than this person. So having that really benefits the patient, I would say.
Yeah. And I would say the way we've structured it is how we want to see GI provider relationships extend, in the community. And it's something that we're working on, and we're engaging with our local organizations and nationally to try to promote. So we understand that not every relationship is similar to ours. And I think a lot of it stems from a mutual respect for each other. It isn't, this is my role and this is your role. Our roles all intersect with each other to the point that we know that we're going to accomplish more if we all are willing to give. We don't have a member of the team that isn't pulling their weight or their load. When one of us is down, the rest of us bring the others up, and that extends into patient care. If somebody's running behind, everybody will help. If somebody needs something done, who's ever available is going to do it. And I think that the patients feel that. So what we don't want to happen is patients to think, well, I don't want to see this person and I don't want to see that person, and the two people aren't talking. And also, we don't want to see situations where either the providers feel that the MDs or DOs don't feel like their APPs aren't at the level that they can trust them, or vice versa, that an APP feels as though they're doing the dirty work or the grunt work, or they're not being treated with the level to which their degree that they earned should provide to them.
So what does it look like day to day? Like, give us a real world example of how you handle the patient cases that come in clinic.
So honestly, Dr. Seminerio is very clinic forward. So I know not all gastroenterologists are in clinic as often as Dr. Seminerio likes to be, which is helpful because, again, the patients have several touch points. So they can have an appointment with Dr. Seminerio, or they can have an appointment with me or the other APPs on the team. Often our schedules are a little bit more open. So, having APPs on the team is helpful because there's better access to the patients, because Dr. Seminerio also does procedures. So that's beyond my scope of practice. So I'm not going to be scoping anybody, but that allows her to both be in the clinic and be up to date with, what's happening, and sharing that knowledge. We'll see complex patients together, and then perhaps I'll follow up with them so that she can, see more new patients. So it's a very equal opportunity kind of clinic. I will say Dr. Seminerio also teaches fellows, and so she has that teaching opportunity. We're actually teaching some APPs also that are getting into the GI fields. It's busy. We see patients often. Dr. Seminerio tends to double book more than I would do so she's probably busier. But I would say, as far as our day to day, we all do clinic. We all see the patients. We answer patient messages on the portal and go through labs. And so we're constantly busy and moving, but
yeah, I mean, I think it's fun. Like, one thing that we always laugh about is when we do have either visiting APPs, or we have my own residents or fellows, or visiting residents and fellows, that they leave this place thinking it was fun. So we work really hard, but it's funny. We're constantly talking to each other. Our doors are always open. We'll come out of a room and we want to share what happened in that particular interaction. There's the all of the clinical stuff that goes on that Megan was talking about. And then there's all the extra. For instance, our patient education conference, Megan and I are doing, but it isn't just us that are coordinating this. The other APPs and the staff are on board, and everybody's trying to help. So that there may be that meeting going on. And in the other room, we may be meeting with our industry colleagues. And in the third room, there might be a research meeting. And so we make sure that we're all involved in all of these. But at the same time, let's be honest, there are things that Megan is really good at and wants to be more involved in that maybe one of the other APPs isn't. And so everybody sort of has their area where they're becoming an expert in, or specialized in, or want to put and promote their time in. And then from my side, the way that I sort of like to lead, so to speak, is I don't micromanage, and I try to make myself present when I need to be, if they need my voice heard. And then, like Megan said, I'm not always physically present here because of the fact that I'll do my procedures or I'll be giving lectures. And so it is sort of an all hands on deck, but we laugh a lot and we talk a lot and we there isn't something that one person knows that the other person doesn't know. There aren't secrets. And that's our dynamic. And I think that's very unique to us and doesn't necessarily have to be the case everywhere. But I think that one of the things that we do really well is that we put in so much effort to these patients, but we also understand that there has to be a time where you let it go and you just, if there's a family emergency, that person's gone and somebody will cover for them. If somebody's not feeling good that day, that all that we have to do is text each other and say, I'm not feeling good. I'm not coming in today. Hey, I'm in traffic. I'm running late. So I think we've just created an environment where people feel comfortable being here. And so therefore they want to be here.
Yeah, no, even when I first met you guys, you seemed like you were very in sync, and there was no like one, oh, this is better than this one, this lady's better than this lady. It really seemed like you guys were really a true team, and that's what I was really impressed with. That's why I asked you to come on the show. And I think for patients, when, oh my God, I can't see the doctor, this is the end of the world. I have to see a nurse practitioner, but I don't think a lot of patients realize the amount of training that the advanced practice providers have to go through and how much they actually really know to be, aligned with the gastroenterologist or a doctor. And, some patients may wonder or be concerned if I'm seeing the nurse practitioner instead of my gastroenterologist. What do they need to know to reassure them? Like, hey, I had great experiences personally with nurse practitioners. Amazing experiences. But for patients that are maybe listening, or maybe they're just starting their journey with a chronic health condition and they're having maybe trouble getting into their gastroenterologist, but the nurse practitioner is available, what do you say to them so they don't put off care and know that they have a very trusted team member that they can contact?
Well, and I think this is a little bit, there's sort of two sides to this question, right? Because one is like, we're a specialty center.
Right.
So everybody here specializes in IBD. For somebody who's newly diagnosed, I think one of the big things is just advocating for yourself as a patient, right? Asking questions. I always tell patients, if you don't feel like your questions are being heard, or if you feel like things are not being answered, or there are gaps in knowledge, and that can either be, from an MDDO or from an APP, it's okay to ask for a second opinion, or it's okay to ask for a referral. So I think there's that side of it. But from our side, one of the things we do is if a patient says, I only want to see the MD, we don't push it. One of the things that I tend to do, and I get asked this a lot, I'll sometimes just coincidentally bring one of my APPs in the room and introduce them that way. So they get an idea that they're around, who they are, they get to meet them. Sometimes Megan will be seeing somebody and she'll bring me into the room just because they want to see me if I can, or I'll do an ultrasound. So we really do try to overlap as often as we can. And then we will tell them, hey, you'll see, the MD one time, you'll see the APP the next time, and it's a give and take. And we try to explain to them too that this allows more new patients to come in and be seen. So, and honestly, from our practice standpoint, as soon as they meet Megan or one of the other APPs, the concern about is the degree of knowledge there dissipates, but we have to get them to the point where they trust us enough to give it a chance.
Yeah, because IBD is such a complex, and there's multiple comorbidities that could go along with that. So it's impossible to have just the doctor see all of these patients. So it's important to really elevate the role of the advanced practice providers too, the way that you have with Megan. I mean, it's really impressive.
It is on a professional side.
Yeah.
On a patient side, what we have to always remember is, to a patient, it doesn't matter that we're seeing a bunch of other patients. To them, they're the most important thing in their world. And so that's why it isn't so, I find that bullying them into doing, or bullying any patient into doing something never gets you there. And even sometimes guilting them into doing it, I don't think gets you there. I think for us, we've really found they're going to get that individualized attention here. It's one of the reasons I think they really like being here. They know if they send a message, it's going to somebody who's going to collaborate. And then also, Megan, myself, the rest of the team, we talk so many times a day. Mm-hmm. So just because you might be getting an answer from somebody doesn't mean that the rest of the team hasn't collaborated together to come up with it. And then, and I'll let Megan talk to this. Megan and our another one of my APPs, Donna Ortiz, have done so much to grow themselves in the inflammatory bowel disease field and continue to progress on their educational status and advance their degrees. And I think that to your point, sometimes people don't know how much work an APP goes through. Specifically to my team of APPs, who I'm so incredibly proud of, they have gone even beyond that level to go and get their doctorate and have done research in this field and become experts in this field. So just being able to promote them is such a gift and a highlight for me.
Yeah, and I 100% agree with you. We never want to feel like we're bullying patients. For me, I hear from patients all the time, they have to wait so long for their office visits. And what we can do here on the show is really showcase what role of the advanced practice provider like Megan, and that they are very well qualified to work with the patients in an IBD center such as yours, and to not wait, feel like, oh, if they don't want to wait, or they don't feel like, oh my God, the wait is so long, but there are other options. Absolutely. If they want to see the doctor, they have absolutely every right to see the doctor, but that may take a little longer, but maybe start with the advanced practice provider, which is just can be very, very productive, right?
Yeah. And I would say too, as an advanced practice provider, our training is long, right? Like we have the ability to write prescriptions and choose medications, and our scope of practice is beyond that of a nurse, right? So we are an advanced practice provider. We can clinically diagnose, we can, look at imaging, we can look at the labs. So we have prescribing authority. And again, like you mentioned, there's that easier access to care sometimes by seeing an APP first, really complex cases, obviously, in other settings too, the doctor will likely have to see. But again, the way our team works, we're all kind of abreast of what's going on between different patients. So that's never really an issue. But our training does allow us to fully take care of the patient, and, having that knowledge and giving the patient that, perspective, like, hey, we're qualified to take care of you. And oftentimes we actually are able to spend a little bit more time with the patients than sometimes the doctors can, because they're double booked, et cetera. So usually once we have them in the office and they see us, they're like, oh, okay, this is much better. Like, well, not much better. Sorry. I don't mean
it is much better. It's much better than they thought it would be. There's sometimes such, we get our own biases in this world, right?
Yes.
And there's a bias towards, oh, I have 2 letters next to my name, therefore it must be different. And you can't, the best way we found to break biases is just show them.
Yeah.
And that's what we're trying to do here, because there is a shortage in gastroenterologists. There is attrition, right? And we don't want to see the patient struggling, and to educate them about these amazing professionals that work alongside and can do a lot of the things that a gastroenterologist can do besides like the procedures. That's a pretty powerful insight for patients. Like they probably, so let's keep along those lines. Like, so if someone were to call, maybe they got a referral to the IBD center, and what are some of and they said, well, the gastroenterologist isn't available for this, but we have would they say an advanced practice provider? Would they say a nurse practice provider? Like how would a patient know how to navigate who they should see if they say, oh, the gastroenterologist is available, but Megan, like, what is that? How do you explain that to them? What should they know?
We've actually spent a lot of time working with our team on this particular conversation. Mm-hmm. So I think the biggest thing is we talk about it as an IBD center. It isn't Jen Seminerio Center. It's an IBD center. Yeah. And so there are situations where, and this honestly comes more from a provider who will refer directly to Seminerio. And we do that that's an important thing for relationship building.
Yes.
When a patient calls in, we're like, yeah, this is the provider, and they're a team. And we really try not to go into too much of, well, she's an APP and not that,
Yeah, right.
I think we really just say this is another member of the team, because it really to us is all equal. Mm-hmm. And if a patient says, well, and you sort of said it perfectly. When a patient says, well, I only want to see the MD, we'll say, okay, this is the timing for that compared to this. We give them a chance to think about it. And if they say, no, I want to stick with that, then they'll get in at that appropriate time. But if they ask questions, well, who is Megan Pearce? Then our team is able to say, oh, she's one of the IBD providers. And we don't really go, she's been practicing inflammatory bowel disease for, 5 years now. And they all work collaboratively together. And I think that very much helps because, again, we're not necessarily promoting a title next to your name. We're promoting the fact that we're an IBD center that specializes in the treatment of this disease.
That's great. Megan, do you want to add to that at all?
Yeah, I would just say, again, introducing us as a team, and again, having that access to care is sometimes the quicker we can get them in to treat their disease and kind of go over everything. And again, using that shared decision making is really important. So knowing that you're going to see a member of the team and we're going to make these decisions together really helps with the patients feeling more confident about their visit. And also, again, if they want to just see the MD or DO, right, like that's a touch point for us to go introduce ourselves. Here's a member of the team. Moving forward, they may be answering your questions on the patient portal or et cetera, so that they get to know us and then they feel confident about the care they're going to receive.
So one more question along these lines, just for patients that maybe they're not able to come to your IBD center. They may live in a different part of the country and they may face the same challenge and the same choice. You can see our gastroenterologist in 6 months, but we have another, they may say the nurse practitioner or another member, they may not say it like you say it. So what should patients be aware of? And again, this is about educating them on the powerful role that advanced practice providers play, but they may hear it in a different way than you guys are very advanced in how you're presenting a care team. Not every place may do that.
I think for some, when you're like, again, if you already know you have a diagnosis and you're calling into a gastroenterology center, you can say, is there somebody at the center who sees a lot of patients with a similar condition to my own, so that they're, automatically put into that, that, and a lot of centers will have somebody, even if they're an IBD expert, who does a lot of IBD. And sometimes it really is not the person that you're expecting it to be based on, like I said, titles next to their name. So I think that's something patients can advocate for, because again, you want somebody that's going to understand the level of questions that you're going to ask. I think the other thing they can ask, is this a team approach? Does the physician work with an APP? Is it something where I'm going to be seeing both of them, or is it going to be one provider for the clinic and the physician for my procedures? Because that sometimes can happen as well. And it a little bit is, you might not want that, or you might say, let me try it out, and if I don't like it, then let me get a second opinion. So I think it's all about asking questions when you get them on the phone. I think one of the things that we do hear a lot, though, from patients is the inability to get an office on the phone in the first place. So when you get that, having those questions, written out and set for you, and saying, listen, I'm okay seeing anybody. I just want to see somebody that understands my disease subset or is going to point me in the correct direction. Because the other thing is, you may see somebody in the community and they may say, listen, I'm not quite at that level to treat you, but I'm going to send you to the specialty center. So sometimes it's a way into the next level. So I think just continuing to advocate for yourself. And one of the hard things as a patient is that you're continuously advocating for yourself, right? Sometimes it feels like it's a never ending, cycle of having to, say the right thing and do the right thing and get yourself the right care. And that is true. That's one of the burdens. When you asked me at the beginning, what's the burdens of IBD? I think that is it, how much work goes into it. But I think those patients that continuously advocate for themselves are going to be the ones that put themselves in a patient-provider relationship scenario that's going to be beneficial to them.
And that's a great segue to, the whole reason we connected was what's coming up in October, the patient education conference that you have. It's the inaugural event. Tell us a little bit about that and how patients could participate.
There are a lot of knowledge gaps, we know, and patients get information from a lot of different places. So it's been our dream for many years to put on a conference that's specifically for patients. So we have a lot of provider gastroenterology conferences throughout the year. This one is specifically dedicated to patients. And we're going to have experts in the field of IBD from all over the country coming in. Our event's Saturday, October 11th at the Renaissance at SeaWorld. And we're going to have topics that are important to patients. So we're going to have a section on diet and nutrition, on the mental health aspect of this disease, because that plays a huge role in their disease course and in their quality of life. And we're going to have topics on surgery, which is also an important thing to discuss when we're talking about care for an IBD patient, and how to navigate some of those challenges with the insurance, because that also is a huge burden to patients, as Dr. Seminerio had mentioned, and who to call and how to get that information and how to get your medication in a timely manner so you don't miss doses, finding those tricks of the trade per se. And then talking about those alternative therapies that are integrated into our medication and procedures and, things people find, because there's a lot of information out there, and we want the patients to hear it from experts, but also an opportunity for patients to connect with one another also.
Yeah. This is so unique because you're actually having these amazing, world-renowned experts speaking to patients. This is amazing. So how can somebody sign up? Is it free? Is there a cost to it?
There is a donation to our foundation that covers the registration process, but we don't want any cost to be a limit to being able to come to the event. So we do have a free code to get in also, which we can provide. I'm sure there's going to be a link to our conference, but there is a website to register. And then if you need the free code, we want you to come regardless of cost, but it does go directly back to our foundation supporting patients, just like them. So it goes back into IBD research, funding, people who can afford medications, et cetera. So it's going to be a great event. So we'll link them.
And we want not just patients, right? We want caretakers there,
Mm-hmm.
family, friends. Sometimes it's so difficult to explain to the people in your life what you're going through. And we want this to be an opportunity for patients and family members to get the knowledge that they've so often, been lacking. And I will tell you, of the faculty that are coming to this, everybody was so overwhelmingly excited and easily committed to doing this, because at the end of the day, we all went into this for, some baseline reason to help people. And we can help people both by educating ourselves, but by educating the people living with this disease. And so that was really what we wanted. We wanted this to be at a level where they can understand. One of the areas that we're very excited for at this is that there's going to be a section from patients to patients that we are just so honored to have you overseeing. And we expect this to be something where there's going to be a lot of communication back and forth between the audience and the panel. We're bringing in patients that have a variety of different scenarios to their disease, and they can sort of talk to their specific situation. And sometimes I think that when you're living with something, it's nice to hear somebody else who has gone through something similar. And you see that they may not be the same, but there are similarities that exist in other people that may have gone through some of the things and tricks of the trade. As providers, we see you and then we move on. We don't live with the disease in the way that you do. But when you're hearing it from another patient that lives with it day in and day out, that can be so impactful to understanding the right questions to even ask.
Yeah, there's nothing that can replace, shared experiences and what patients feel empowered from the stories of other patients. And we've seen that, over the years. We see it in our YouTube channel, like the patients just sharing information, and it's amazing how powerful that is. But I'm super excited. In full transparency, they've asked me to moderate a panel with some amazing patients, and I can't wait to participate in that. And I hope our audience are able to join us, especially if you're in Florida. We'll have a website link and a code, maybe, hopefully, for those of you who need it. Dr. Seminerio and Megan, thank you so much for showing us how strong the nurse practitioner and gastroenterologist team can be in supporting patients and making informed choices in their IBD management. And thank you for giving us this amazing update on the conference. I can't wait to participate. And for our listeners, remember, you're not just a bystander in your care. You're the most important member of your care team. So don't hesitate to ask questions, search for information, and try to find the best evidence-based resources out there, and share your concerns and ask your questions.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.